It's Monday morning here on KSJE. You're listening to the Scott Michlin Morning Program, and my guests in the studio this morning from Presbyterian Medical Services. And as I always remind our viewers and listeners, I'm a proud member of the Board of Directors for PMS, so there's that connection as well. But I want to welcome to the KSJE microphones this morning, Ryne Hemstreet is here. Good morning. You're the Carelink Administrator for PMS, right?
Correct, yes.
Very good. Good to have you here. Thank you for being here.
Thank you.
And also, Cody Lewis is here, Physician Assistant for PMS. Good morning to you.
Hi.
Good to have both of you here. Thank you both for joining me. And so as we talk a little bit about what's been going on, Cody, let me start with you a little bit about flu season, because we always hear that we've had a pretty busy flu season in Farmington and San Juan County in New Mexico this year. Is that true?
Has been, yeah. It's been picking up speed.
And how are things looking these days? Have we peaked? Are we about to peak in the month of February, or what would you say from what you're seeing in the
last
clinic?
several years it's peaked in February, so yeah, it probably will peak in February, but it continues on through April or May usually.
Gotcha. Flu shots still available?
Absolutely, yeah. We still have flu shots at our clinic.
And you advise folks to still get one if they haven't yet?
I definitely do, yeah.
And what is the kind of the age range or the suggested time for folks to get a flu shot? I know it's most, if not all, adults, but who else should get one?
Well, kids under 5 and especially under 2 are most at risk, and then adults over 65 are very at risk for flu and complications from flu. Anybody can get the flu, but basically anybody over 2 months old should get a flu shot. Yeah.
Gotcha. And that's part of the important thing to note is that the complications, right? Because flu can lead to other problems.
Yeah.
If you are, if you have health problems already, perhaps it could exacerbate some of those, couldn't they?
Yes, most definitely. Yeah, flu is not normally a deadly disease, but it can be if you have other illnesses or a poor immune system.
And it does kill a number of people each and every year in this country, does it not? Despite our best efforts.
It kills tens of thousands of people every year. Yeah.
And I think we forget about that sometimes. So when we talk about flu and the flu season, so it's important to remind folks about getting a flu shot. So I appreciate you doing that this morning. Thank you. Let me turn to Ryne a little bit about your position at PMS, Ryne. That is with Carelink, and we were talking before we came on the air this morning a little bit about the job that you do of trying to help coordinate with patients and get them to different services, whether it's medical or dental or even behavioral health, which is what PMS offers in the San Juan County area, correct?
Correct, yes. So Carelink is a state-developed program that PMS adopted, and we do all the medical care coordination for San Juan County residents with Medicaid and a diagnosed serious mental illness. So we're pretty much the bridge program between medical and behavioral health. Got you.
And so I guess many times some patients present and they need the help of both services, both medical and behavioral health?
Yes.
And that's where you come in?
Correct, yes.
And so what things can you offer, I guess, is just figuring out how they can be seen, making appointments, but also how this gets paid for? Is that the idea?
Yeah, so the program is paid for through New Mexico Medicaid, and we have care coordinators and health promotion educators in our program to kind of re-gear their treatment towards focusing on their medical as well. And that can include, again, medical, it can include dental, vision, psychiatry, as well as behavioral health. If they have any complex medical conditions, we coordinate that care with outside specialists, outside providers as well. That's pretty much it.
Right. And I guess because of you and the job that you do, then these folks are able to then get connected to these other providers and these other specialists then without having to do a lot of homework and research on their own. You can get referrals and things that they need, right, for all these, what is part of modern medical care, right?
Correct, yeah. And our care coordinators and our health coach, our educators, they're kind of that extra advocate, that extra resource for our clients, kind of taking that stress off the clients and say, hey, throw that stress at us, we'll help you with it.
Right. Well, I imagine a lot of people do get a little overwhelmed, don't they, when they're maybe dealing with, it may not be themselves, but maybe a family member who's in need of some of these many different types of services and where to go and where to turn and who can help them, that kind of thing?
Yeah, and doesn't have to necessarily be the client specifically. If it could be offering family support as well. If a client or a child or anybody is going through this type, going through their treatment, whatever, we can offer that family support services for the family, educating them as well, like what exactly is going on with, your family and what we can do to help you.
Right. And that's been, I think, a part of the idea behind PMS and Presbyterian Medical Services and what they offer in the area with having the medical clinic and the behavioral health services and the dental and things like that all under one roof to kind of almost be a one-stop shop.
Yeah, correct.
And that's what you do
Yes.
with these folks.
Yeah, we help, again, help build that bridge between all these services, being able to provide that wraparound service, not only with our program, but with PMS in general.
Right. Very good. Okay, thank you. And Cody Lewis, let me turn back to you a little bit about the work that you do, because part of what you do is being kind of the walk-in person that folks might see, and PMS I know has been working really hard to get appointments and be able to offer someone like you to see a patient who just walks in off the street maybe without an appointment because they're not feeling so good that day or their child isn't feeling so good that day. Is that the idea?
Right. Yeah. So I only take walk-ins at our clinic, but we have 6 other providers. 7 other providers who schedule appointments out.
Right.
I'm there to facilitate people coming in the same day. So more for acute care stuff or urgent care stuff. You can't wait 3 weeks to get in because you have the flu or a cold or something.
Right. And that is, kind of unheard of these days in medical care, is it not? Unless you're going to an urgent care or an emergency department, right, to be seen without an appointment. That's crazy talk. It sounds like to me.
Right. So it's nice at PMS because I can integrate directly with the providers that are there all the time, so I can see a person and be in the same building with their primary care provider, and I have access to their notes and their old medications and that, and I can get them in the same day for med refills, and it makes it a lot more streamlined for the patient.
Right. But I guess that also means for you never know what you're going to see in a given day, right?
More fun that way.
It could be anything, right? Mm-hmm. And that's fun and challenging and both, I suppose?
Mm-hmm. Yeah. We see lots of good stuff at PMS.
Right. And I know a lot of this is for customer care, and again, to be able to let folks know that they can do this and show up and be seen relatively quickly. And that's a relatively new thing, is it not? Or has it been going on for a while?
We've had a walk-in provider prior to me being here. And so it is a relatively new program that we've piloted in the last year or two, I think.
Okay. Because there's something to be said about having someone available to see walk-in patients. There's another thing to actually have them walk in and be able to be seen within, I don't know, do you have a goal of 45 minutes, an hour, or what would your goal be?
We try to keep it as short as possible. No way to control how many people walk in at the same time. But
that's true.
We've been getting people in within 45 minutes or so, I would say.
And that's pretty amendable, I would think, or commendable for you.
Not bad for urgent care.
Right, when folks are coming in and things like that. And of course, being on the board, I have seen how many patients come to the Farmington Community Health Center, and since it's been built, a lot of it is one of those, to use the baseball analogy, if you build it, they will come. And it seems like the numbers keep growing and the patients keep coming to the center for all different types of medical care, whether it's pediatric or adult or senior or whatever, right?
Yes. Yeah, we do have Dr. Pomo there, who's a pediatrician, so we do have the specialist there. And then quite a number of primary care providers. Yeah, the numbers keep getting bigger and bigger.
Bigger, right? Mm-hmm. So the need is there, I would think, in the community is what it tells you and shows you, right? And so talk to me a little bit about, even both of you, a little bit about the changes in medical care. With this expansion of Medicaid a little bit and making services more available to families and to individuals in our state, and the Affordable Care Act, I think, has helped with that. We're not going to get political, but I think anytime people have better access to medical care has to be a good thing, especially coming from someone in the medical field, isn't it?
Certainly my feeling on it.
Right.
The more people that have access to medical care, that's my feeling.
Sure.
People should be able to get into
without having to worry about how to pay for it.
Right, exactly.
I'm more apt to go see someone like you if I don't have to worry about where I'm going to get the money to pay for seeing someone like you.
Right. And of course, with ACA, we've had a lot more people with access to insurance than prior. So naturally, we've seen a lot of people who probably wouldn't have come into the clinic before because it would have been too expensive.
Right.
But at PMS, we take practically every insurance. I can't think of any off the top of my head that we don't take. So we definitely we see a lot of patients.
Right. And I know even if someone's private pay, there's a sliding scale, so it's all dependent on other stuff too. And as a board member that I know, and so I know they really work hard to take whatever insurance is out there, or affordable care, or whatever private pay. It doesn't matter really. They'll figure out a way to get you service.
We work very hard to get patients seen and
Right.
get them the medical care they need.
That's the idea. And Ryan, same question, I guess, to you a little bit about the work that you do with the, again, Affordable Care Act and having folks having more access to medical care and behavioral health care and things like that. Does that help with your job a little bit, or is that a change that you've seen?
No, it's definitely helped, and it's been very beneficial to our clients as well. Being able to get clients and seeing where they need to be seen, and making healthcare as accessible as we can for our patients. Yes.
Right. I imagine you don't have those conversations with folks about, well, that sounds great, but I don't know how I can afford to go see this specialist or go see this behavioral health person or its counselor or whatever it might be.
Yeah. So I mean, our main focus is, let's make sure you're taken care of, and we'll communicate with community resources. As well, to make sure, let's not worry about the payment. First things first. Let's make sure you're taken care of, and then after that, we'll provide them the correct support and resources that they'll need after that.
Right. Good point. And Cody Lewis, a little bit about, again, medical care, preventative care can really help solve a lot of problems maybe down the road for some folks. So if you've got folks who are now coming to see you for maybe physicals or just regular checkups every so often, that's got to be better long term for their health, right? Instead of someone waiting 50 years and saying, "Well, I guess I should go see somebody about this thing that's been happening to me."
Get lots of that too, but if we can catch stuff early, we definitely have a better chance of dealing with it.
Right. We often hear though that there are people that are maybe a little stubborn, for lack of a better word, about maybe coming to see a doctor or healthcare provider and dealing with stuff until maybe it is a little bit more of a serious problem.
Sure. Myself included.
Okay, well, thank you for admitting that. But it's really never too late, though, I guess. Better late than never. Is that the advice?
Of course, yeah. Naturally, getting a yearly checkup helps to catch stuff that would be much more difficult to control down the road.
Right.
But, it's never too late until you're dead.
Well, there you go. That's true. Well, very true. But there's still a lot of things, and again, seems to be a lot of advances in medical treatment and technology and things like that for things that maybe you can find before they get really serious at the very maybe beginning stages, and there's still a chance to maybe correct some of these things or stuff like that. I know we have a big problem here with diabetes.
Most definitely.
And when a lot of folks are maybe pre-diabetic, there is an opportunity to maybe reverse some of that, or at least keep it from turning into full-blown diabetes. That's still something that
absolutely
you spend a lot of time with, right?
The testing for that sort of thing is very simple. So some simple blood tests. So there's no reason not to get checked for that sort of thing.
Sure, because we have a big problem with it here, don't we? A big population that is dealing with that.
We definitely do. Yeah, it's rampant here.
And as we've already talked about, that can cause other complications, can it not, if you don't keep it in check and deal with it?
Diabetes specifically?
Sure.
Absolutely. Nobody dies from diabetes. You die from the complications from diabetes. It causes problems with your heart, your kidneys, your feet, your hands, your eyes, eventually your mind, everything. Yeah.
Got it.
Yeah.
But it all starts with the diagnosis of diabetes,
correct.
Basically, and then it causes other issues as well.
Yeah, and in most cases, it's a very controllable disease. Some people believe it's a reversible disease. It can be controlled in practically every case,
right?
Depending on the type of diabetes it is.
Sure, but some of these diagnoses of pre-diabetes that can really be maintained, and in some cases, I know we can't talk about every person, but
but that's vital. If we can catch somebody with pre-diabetes instead of full-blown diabetes, it's much easier to control.
Sure.
In a lot of cases, we can control that with diet and exercise programs instead of medications.
Gotcha. And here we are in February, and it's Heart Month, and I know you're not a cardiologist, but there's still some things that we can do, right, for heart health and those types of things to keep our hearts healthier than going down the road and having a problem?
Well, most definitely, yeah. Cleaning up diet, keeping the white carbohydrates out of your diet, exercising as much as you can without hurting yourself. That's excellent for your heart. It makes a huge difference.
Right. And heart disease is still a big problem in this country.
Most definitely. As far as I can remember, it's the number one killer.
Right.
Yeah.
Right.
So it's a huge problem. It's a huge problem all over the world, but certainly in the United States, where we have a Taco Bell and a McDonald's on every corner.
Exactly. That can be a little bit of a contributing factor, I suppose. So that's true. Tell me, if you would, what's the majority type of patients that you see on a daily basis? Is there any particular type of person that comes in to see you, or is it really everything and anything?
We see everything that you would see in a typical family practice. We certainly have a very high percentage of diabetics, heart disease patients. Personally, I see a lot of colds and flus and injuries that aren't as typical just because I'm a walk-in provider and an acute care provider. And I do a lot of derm and procedures at the clinic as well. Personally, but across the clinic, I would say we see lots of high blood pressure, diabetes, heart disease, that sort of thing.
I see.
Long-term, ongoing problems.
Gotcha. And again, these things can be dealt with, and depending on how severe they are or not severe, they can be treated.
We surely try.
Yeah.
Yeah, in most cases.
Right. And I know there's a big push out there, and when I serve and go to a board meeting, we talk a little bit about the quality of care at the clinic and from the providers like yourself. And I mean, you guys are on par with anyone else in the community, I would say.
Part of the revamp of medicine in the United States and part of the Affordable Care Act, and that has been holding us to quality standards and making sure we do certain screenings and keep patients to a certain quality of care as far as blood pressure controls and keeping their diabetes A1C numbers to a certain standard, and that regular well woman checks and pap smears, that sort of thing.
Sure.
But yes, we do a whole lot of that.
And that's part of what I see as a board member is that, someone may come into you with a cold, and you may do a test about them for diabetes or something completely, maybe thinking that it sounds unrelated, but it may not be because of these quality indicators that you want to make sure that they have been checked for some of these things because they came in to see you.
Yeah, so speaking to my job specifically as a walk-in provider, I have the opportunity to do a lot of tests that I wouldn't do if I were at an outside clinic, because I'm plugged directly into the primary care providers there. So I end up doing a lot of diabetic foot checks and eye exams and blood tests and cholesterol tests that are more typically in the purview of your primary care provider, just to keep people up to speed and on track with those tests.
Right. And I guess the idea is that maybe that patient has never had that done or not done recently, and so by doing those tests when they're there to see you, you may be able to uncover maybe something else that they should be at least made aware of.
Very frequently do. Mm-hmm.
And that could cause other issues, or maybe not avoid other issues if they start getting treatment for those things. Mm-hmm. And that's an important thing. And I know you almost have a checklist of things that you want to go over with patients when they come and see you.
We do indeed have a checklist.
It's exactly a checklist. Gotcha. Well, it's very interesting. And again, it's all part of this. And I think that seems to be the way healthcare is going when we talk about quality, and that consumers should be able to see how providers rank, I guess, for lack of a better term, on doing some of these things when a patient comes to see you. Is that part of where we're going?
It is. I couldn't tell you off the top of my head how you find how we rank and how public that's been made at this point. But
I think we're heading that direction.
More than likely,
yeah.
I would assume so. And definitely, it's all recorded by Medicare and Medicaid programs. They record our quality indicators and that sort of thing, and they do rank us as providers. And
that's, I think, important for folks to understand, because you get a lot of money from the federal government to provide some of these services and help to pay for many of these patients that are coming to see you and others. And so the government wants to know how well you're doing in all these different areas, right? With these
Correct.
with these procedures or tests or whatever whatever's on that checklist, I suppose.
That's correct.
That's what they want to do, what they want to see. Got it. Very good. Ryne, let me turn back to you a little bit and give you some time on the microphone and the cameras to talk again about Carelink, and as Cody Lewis talking about some of these checks that folks are going through when they come and see him, and maybe finding out some other problems or other issues maybe that they have. Is that something then that they can pass along to you to help, again, get them set up with other providers and other people to go see?
Yeah, and so just like the clinic, within our program, we have quality indicators and quality measures that we have to meet as well. And then again, knowing what needs to be met, knowing those screenings, getting those screenings done in the appropriate time does help prevent any further complications. But the one thing about our program we're able to do is we're able to take that care into the home. If they have a care plan or a plan of care developed by the providers, our care coordinators and our health educators, they're able to take that plan of care and take it into the home and help the client actually apply it within, make it a little bit more personal to them, so they don't have to come into the clinic, for that type of education. We can take that type of education into the home.
Right.
And we also provide educational classes that are open to the whole community at PMS, and it can be diabetic specific. It can, communication, lifestyles, relationships. A lot of these classes that we provide, they're specific to this type of population, classes that they've requested specifically. So.
And these classes are free of charge?
Free of charge, yes.
Right.
They happen every Wednesday.
Okay. At the clinic, right, or near the clinic?
Yeah.
Is that where they are?
So they happen at our clinic in our community room every Wednesday from 9:30 to 10:30. We're also open to taking these classes to outside,
Gotcha.
to the outside community as well.
And this idea of home visiting and taking these things to the home for certain things, that's a relatively new expenditure, is it, or a new program, or part of the program?
It's part of the program. It is part of the program. It doesn't have to be our care coordinators or health educators specifically. If a client is having a hard time, getting to the clinic, or has, anxiety issues in going to a clinic or going into a large surrounding, we're able to link them to resources and, be able to provide that type of care in the home, as well as communicating with providers.
Gotcha.
So what's, so-and-so working on, and what can I do in the home with this client to help them? And that's something that we're able to provide.
Right. And these type of services are for what types of conditions, would you say? What would make someone eligible for a home visit suffering from what type of?
So to qualify for our program, you have to have New Mexico Medicaid and reside within San Juan County. Mm-hmm. The other requirement is being diagnosed with a serious mental illness or a child with a severe emotional disorder. Those are the two qualifications for our program specifically.
Right. So it's more behavioral health than medical is what I'm...
It's a medical program underneath the behavioral health program.
Got it. Okay. But it's for those types of conditions, which I understand could be, very detrimental in keeping someone from coming maybe to see you at the clinic or at the office of a provider in order to be able to maybe see someone in the home, which is certainly a little more maybe of a safe environment for some people.
Yes, correct. Yeah.
And that's how it's designed, right?
Yes.
Very good. Well, gentlemen, we're almost out of time, but again, the clinic is open. Do we know the hours of the clinic? I'm just thinking I don't know it, and I probably should as a member of the board, but...
Well, we have providers starting at 7:30 in the morning, and then we finish seeing patients usually around 6, depending on the provider.
Got you. And again, for medical issues, folks can kind of walk in and probably expect to see, if not your smiling face, somebody else's smiling face.
Your provider, if you're established with somebody, or you'll see me.
Okay. But that's how it works, even without an appointment.
Yes, sir.
Is the idea, right? And Ryne, for you, kind of same, you're there, or your staff is there while the clinic is open?
Yeah, while the clinic is open, our staff is there as well.
Gotcha. Okay, very good. Well, gentlemen, thank you both for coming in this morning and talking a little bit about the work that you do for our community with Presbyterian
thanks
Medical
for having
Services.
us.
Yeah, cool. Thank you.
You're very welcome.
Appreciate it.
You bet. Thank you both very much. My guests here from PMS, Presbyterian Medical Services, with me on KSJE.